You already know, SHA officially went live on October 1st, 2024, and the NHIF admissions, they stopped on September 30th, 2024. Millions of Kenyans, they woke up inside a new system overnight. Now this speed, it mattered politically. Number 1, Ruto's administration, it had framed SHA as a proof of delivery. Number 2, universal health coverage, it had deadlines. Number 3, budget cycles, they were closing. And 4, public trust in NHIF had collapsed. So here the order was simple. You switch fast, you fix later. Now let's look at what SHA inherited on day 1. It inherited incomplete NHIF data. It inherited duplicate member records. I remember I told you this. It inherited facilities empaneled under old standards. And SHA also inherited providers trained on NHIF logic. There was also a technical gap. SHA relied on the Integrated Health Information System. Now that system, it was live, but the full biometric enforcement was not. OTP authentication, it still sat between patient and claim. Manual overrides, they existed for emergencies, and bulk claims pipelines, they stayed open. Now I need you to remember that because fraud, it needs gaps. And from what I've just said, you can see how many gaps were there. There were empanelment failures. There were facilities being approved using paperwork. Some inspections happened, but many did not. Again, these gaps that bring fraud. Imagine a level 3 clinic, it could self-declare capacity. You know, the bed counts, theater access, staffing. To add salt to the injury, verification lagged behind approvals. This allowed the facilities to enter the system first, and then the questions came later. Let's look at the provider behavior shift because this one, Under NHIF, claims moved slow. Under SHA, reimbursements moved faster. The providers noticed this immediately. The claim volumes, they spiked in October and November 2024. Hapa hivi, inpatient admissions, they were rising sharply. Maternity claims exploded, and C-section ratios, they crossed medical norms. In this particular period, when SHA was brought in, it was just mad chaos, like the chaos continues. The manual overrides. Also, hospitals used emergency clauses to bypass biometric failures. The claims officers, they were approved under pressure. This chaos. Patients needed care, but the system stayed unstable. This manual approval, it became routine. And this is where the money started leaking. Because you know, everything that is manual, questions. Now we also need to talk about the OTP abuse because these facilities, patient OTPs were reused. And then after being reused, they were shared to other facilities. These facilities, you know, they're working together to milk as much money as they can. The same patients' OTPs. Claims got filed for visits patients never made. Admissions were being logged remotely. And all this was happening before the AI full enforcement kicked in. Now we can also look at the geographic clusters. Some certain counties, they lit up early. And I'm going to mention them. Mandera, Nairobi informal settlements, and parts of Kisii and Bungoma.